Hey, hi everyone. My name is Jessica Baxter, and my presentation is about maternal mortality in Nigeria and disease burden metrics in Nigeria and all things Nigeria. So, defining maternal mortality in Nigeria, the crude mortality rate for maternal mortality here is 1,091, with 7,266 in 1,000 live births accompanied by this many maternal deaths. So, the crude mortality rate and just the maternal mortality rate in general is extremely high in Nigeria. It's the highest actually in the world. And largely, most of these deaths are largely preventable. There are many factors that cause women to die during childbirth, or from complications in or during after pregnancy, and they're, like I just said, very preventable. And um, there are biological conditions that may have existed before pregnancy, but are often intensified and worsened during pregnancy, without access to care and infrastructure problems and lack of access and things like that. So we'll go ahead and get into it. So some risk factors for these things for maternal mortality are pre-existing conditions like heart disease, obesity, a compromised immune system, and a lot of times in Nigeria, because of the lack of access to care, they don't have the ability to treat these conditions in the first place. So they don't, they have these conditions and then they get pregnant, and that amplifies the risk factor. There are conditions during pregnancy, preeclampsia, high blood pressure after 20 weeks, gestational diabetes, high blood sugar, hemorrhaging during pregnancy and during childbirth, and infection. A lot of women do not give birth in sanitary conditions or have a skilled attendant on um, board to help them give birth. And so there is a high risk of infection and hemorrhaging, and that is a really big risk factor in maternal mortality, especially in Nigeria. Some socioeconomic risk factors in Nigeria for maternal mortality are poverty, employment status, education, structural bias, and social inequity and social inequality. Environmental risk factors include poor water quality, climate change, air pollution. Flooding is another big one that I've learned about through the course of this course. And some other factors that kind of didn't fit into these categorical things are older maternal age and unhealthy lifestyle habits. And again, a lot of these things are a problem stemming from other problems, and unhealthy lifestyle habits may not be something that they can necessarily choose. So, some primary, secondary, and tertiary levels of maternal mortality prevention in Nigeria. Primary means we're going to try and prevent it before it happens. There's not a problem yet. So we want to, there's health promotion, prenatal care, birth planning, proper nutrition to prevent infection. Um, and I just noted that, infection prevention is a primary, is also a primary level of prevention, but it also prevents many other things. Family planning, accessible, affordable, quality, essential care for women who are pregnant, and just the improvement of public health services in general. That's important. Secondary, early detection, and then the prompt treatment of changes occurring pre and postnatal, and then during childbirth as well. Um, this just means, okay, we know something's wrong. What are we going to do to fix it when it's happening? Um, there needs to be safe ways of pregnancy termination. A lot of women are having unsafe abortions, which causes maternal mortality in Nigeria. And then there also the provision and training of skilled birth attendants is really important and critical in and during childbirth. And it's important to have someone there that can be trained and knows what they're doing. And then adequate care for giving birth and just checkups and things like that is really important. And then in terms of tertiary prevention, this is what is occurring after the fact. And a lot of women who are dying in childbirth can um, receive cardiac rehabilitation. And then it's just more so a management of critical conditions if they've gone septic or they have an infection or all these things that we're just looking to manage that. And then also the prevention and management of other risk factors as well. Health and human rights is a big thing to think about in Nigeria. In Nigeria, it is said that all individuals have the right to accessible, affordable, and quality health care, as well as the right to non-discrimination, dignity, and equity in health access, as determined by like the WHO and also Nigeria's government. Health is also a fundamental right, as affirmed by the Declaration of Human Rights in the WHO's Constitution. However, the major problem is a lack of access to care at all. Safe maternal care, a lack of immunizations and education about that. Poor, a big, huge one in Nigeria is HIV and AIDS and TB treatment, and having no access to that and those treatment services and educational services violate health rights. Violence and crimes in Northwest Africa also disrupt human rights and health rights. Um, Kidnappings, unjust killings, looting, these all create really dangerous environments for people and it prevents people from being healthy. And also just being able to make choices that benefit their health, um, and their wellness and their family and all these things. Um, Poverty and inequality continue to create economic shock. Families often struggle to afford food, and um, environmental things create, flooding, raining, all these things create inequality and poverty, and they disrupt health and human rights in Nigeria. Um, there is an occasional impact in decreasing this health burden and improving global health outcomes. A lack of access to maternal health, child health care, HIV and AIDS treatment continue to contribute to the high disease burdens. However, all these things can be improved through ensuring ensuring women's rights to pre and postnatal care, safe delivery, health planning, family planning, and ultimately it will reduce maternal mortality. Um, and that just kind of applies to maternal health, but in terms of HIV and AIDS and TB and child health, access improvement will kind of improve global health outcomes all across the border and impact in and surely impact in decreasing the disease burden as well for all those diseases, but also maternal mortality. Um, since the Ebola and COVID-19 outbreak, um, these infectious diseases have kind of created a need and a desire, but also a stronger health system in Nigeria, to prevent the spread of diseases. And they are aware of these diseases and the need for accessible infectious disease prevention techniques and strategies. Um, Equity and access also produces a significant decrease in disease burden and contributes to global health outcomes. And also, we know that provided education creates prevention techniques and strategies that contribute to better health outcomes. Um, this decreases the disease burden a lot with things like the maternal mortality and HIV and AIDS, things that are preventable and non-communicable. I know some of those are non-communicable, but they have the ability to be decreased, and contribute to better global health outcomes. Some socioeconomic factors, poverty, just poor access to public services, infrastructure inequities, unsanitary environments, food insecurity, poor environments all contribute to poverty problems, and so does employment. Access to healthcare is affected if you don't have a job. and it can ultimately determine the ability to afford services and be provided services, and as well as a lot the time to seek health-seeking behaviors. Um, Education in Nigeria also influences not only women's view of their health, but everyone's view of their health. And it's not always accessible for women, especially women, but also for everyone. Um, and having an education increases the chance of safer deliveries, but also better health outcomes. So, some environmental factors, water quality, climate change, and air pollution are big things in Nigeria. Water is often collected from unsanitary places, and it ultimately provides little to no sanitary protection. So, ingesting the water that has heavy metals or pesticides in it results in poor maternal health outcomes as well as fetal circumstances that are not good. But the lack of infrastructure, quality, water quality, public health officials, and healthcare in the area is a major concern because it affects how women are able to have healthy pregnancies and deliveries, but also just for the general health of the population in Nigeria. Oh, sorry, and climate change, um, infrastructure, healthcare, clean air and temperature all affect health, and especially for women who are pregnant, they are more they're more vulnerable, and need to kind of protect themselves and another person against these things. And um, extreme heat during pregnancy and poor water conditions introduce the risk of vector-borne infections, mental, respiratory, and diarrheal infections as well. Air pollution is a big one in Nigeria, and it's the second leading factor for death there. Um, Pollutants in the air increase risk of maternal mortality for women, obviously, but also just in general in Nigeria. And it threatens lung conditions, creating a weakened immune system and raising the risk for respiratory conditions that contribute to maternal mortality and death rates in Nigeria. So, some funders of interventions that go towards promoting the prevention of maternal mortality and also just promotion of healthcare and equity in Nigeria are actually the United States of America's President's Emergencies Plan for AIDS relief, because AIDS is such a large problem in Nigeria. The United States has a plan in place to aid them in that journey. The Nigerian government, local organizations, and local humanitarian responders, as well as humanitarian responders that come in from outside. And their focus is really developmental sectors like health, agriculture, education, economic development, and infrastructure, because these things are the foundation of why everything else kind of crumbles. And so these governments and organizations have placed emphasis on focusing on those things. PEPFAR aims to address epidemics and coverage gaps in Nigeria as well, which is really interesting. In the malaria campaign, these are some examples. The malaria campaign is over disease control, HIV and TB grants, and immunization access, which is really important, especially in maternal mortality. The Nigerian government and the Federal Ministry of Health and National Agency for the Control of AIDS in Nigeria has the ability to oversee programs' ability to align with the Nigerian health priority and strategies. So these funders, um, they're able to help the disease burden in Nigeria because of this. Um, and continuing on this, NACA, um, they play a major role in overseeing that the Global Fund programs are able to be integrated into community health programs, hospitals, and clinics. And health program implementations at the community level are implemented through global funders to ensure equity for all populations and reduce stigma around HIV and TB. And this is really important because this kind of shows directly how um, funders are involved in interventions and what kind of happens with disease burdens moving forward. And the fact that these funders are able to um, fund and contribute to these major programs that are able to be integrated into rural areas in Nigeria, hospitals, clinics, health programs within communities is really important. Um, and those kinds of things happen for, again, those developmental sectors like maternal mortality and HIV and AIDS and these things that we know Nigeria has a really big problem with. So that is how intervention funding is done with funders. This is my citations page. So thank you so much for watching.